My name is Kayla Dowler, and these are special tests of the knee. First, we have the anterior drawer test, where we have the knee flexed around 60 to 90 degrees with the foot resting on the table. We then put our hand behind the tibia and attempt to displace the tibia anteriorly while the foot remains resting on the table. A positive test is indicated by laxity, so that's why I'm comparing the two. And you also need to repeat the test in 15 degrees of external rotation and 30 degrees of internal rotation to determine the intensity or grade for a tear of the ACL. A positive test is indicated, like I said before, of laxity and it would indicate an ACL tear. As seen in the video, I compare each side with each version of the test, the 15 degrees and 30 degrees, and straight on to be able to determine if there is any laxity in those ligaments. The next test is the posterior drawer test, which is very similar as the anterior drawer test. And you keep the knee flexed at 60 to 90 degrees, with the foot resting on the exam table, and you put both hands behind the tibia and thumbs anteriorly on the tibia plateau, and you are pushing posteriorly. And a positive test indicates a PCL tear with laxity. The next test we have is the anterior Lachman's test, and we are going to place the knee joint in 20 degrees of flexion and have one on the femur for stabilization while the other hand is applied to the posterior aspect of the and we're going to be seeing for any subluxation, which would indicate a positive test of the ACL. The next test we are performing is the posterior Lachman test, which is very similar to the anterior Lachman test, except we are looking the opposite direction for any laxity indicating a PCL tear. So meaning we would compare both sides. The next test we have is the valgus stress test, and we are going to place one hand on the lateral aspect of the knee and one hand on the calf, and we are going to push the knee medially, and we are going to do the same thing on the side of the table, 30 degrees, looking for a MCL tear. We are now going to perform the valgus stress test, which is going to be the opposite of what we just did. And we're going to put our hand on the medial aspect and our other hand on the calf. And we're going to push laterally. We're going to do the exact same thing where we move the leg to 30 degrees off the table. And the positive test would be indicated by laxity, and it would indicate an LCL tear. For the Apley's compression test, we are first going to flex the knees and then externally and internally rotate the tibia as far as possible. Then the examiner is going to put his leg on the thigh and aggressively externally and internally rotate by placing both hands and leaning in to the rotation, and a positive test would indicate a meniscus tear by pain at the site of initial injury. The next test is the McMurray's test. And first, we're going to flex the knee, and we're going to press the heel into the knee, rotate the thigh with the knee still in full flexion as we extend the knee out. The click will occur, and the patient will be able to state if that's how they felt when it gave way. And a positive test would be indicated by a painful click, indicating a meniscus tear. The next test is a Thessaly test, and you're going to have the patient stand on one leg with a slightly bent knee, and you're going to have them twist internally and externally 3 times, and a positive test will be indicated by pain, indicating a meniscus tear. The next test is a hamstring 90-90 test, and we're going to have the patient lay down and flex their knees to 90, put their hands behind their thighs, and straighten each leg individually. And a positive test would indicate if they do not have greater than 20 degrees of full flexion, indicating a hamstring strain. In this case, they would be positive. For the patellar apprehension test, you're going to flex the knee to 30 degrees, and you're going to press using your thumbs on the medial side of the patella and exert laterally, both on directed pressure. And if the patient becomes apprehensive or tries to straighten their knee, that is a positive test indicating patellar subluxation. The next test is the patellar compression test, and you're going to place the web part of the thumb above the patella, and you're going to ask the patient to flex their quad while applying downward pressure. A positive test is indicated by pain and indicates patellofemoral dysfunction. The next test is the Aubers test for the knee, and you're going to have the patient laying on their side with the tested leg on the top. We then move the patient's leg first into flexion and then through to abduction combined with extension until the hip is positioned in mid-range. The thigh is then allowed to drop, and a positive test would be indicated if the leg stays horizontal or above, indicating iliotibial tract syndrome.